Radiation oncology services are it's a very expensive service. However, we shouldn't use how expensive it is to deny access to it. Like Prof. Luke has just mentioned that on our available tertiary services grant, we're looking at decentralizing breast cancer early diagnosis machine, which is a mammogram, at the regional hospitals, so that they can be diagnosed as early as possible, and early diagnosis assist in early management and probably, and most probably, curing or getting into a situation where we could avoid the spread of the cancer or get into remission. So our intention is not for us to be the only center for oncology services, but to make sure that chemotherapy is available at the regional hospitals as a start, because at least it's closer to where the people can go to. We're willing to share the skills, we're willing to enrich, bring in some doctors who might be interested. It doesn't have to be a specialist to give chemotherapy. Even a nurse can give a chemotherapy, as long as the necessary workup has been done and the chemotherapy, the solution is prepared. We also want to see our brother tertiary service, tertiary hospital in Rustenburg, developing into to cover, because they've got the bulk of the population. I mean, they've got more than 1 million population that side, to be able to provide the oncology services there. So for us, it will start as an outreach or an inreach and establish the chemotherapy unit, and then for them to be able to procure all other necessary oncology related services. I mean, we're buying equipment that's got a minimum of lifespan, if it's not, of 12 to 15 years. So in the next 12 to 15 years, we can be assisting these guys to build so that we can be ready to replace this one as soon as they've created their own oncology services. So training, we want to make sure that we spread our wings, because we've got an advantage of having that link with the two universities, the University of Johannesburg and Wits, and also very soon we will be going into the Northwest with the intention of actually we've got a target of building a medical school and the 11th, it will be the 11th medical school in the country. So we now have, I can basically say that we train undergraduate, so we will be developing our own than to recruit people outside, because then it's really, people say, Northwest, what are you talking about? But if you're getting people from Northwest, it's easy for us to keep them within their own province. I've seen that developing your own is best than to recruit people from outside and then they come after 2 years or 3 years or so, they leave and the service is been established. There's no somebody to continue to provide the service there.